The article I will be presenting on today is titled Virtual Reality Exposure Therapy for the Treatment of PTSD Following September 11, 2001. Since its initial rise in prominence in 1999, PTSD has been thought to be best treated by cognitive behavioral therapy that utilizes imaginal exposure. Though this therapy has been documented to work, imaginal exposure still presents a problem to certain patients. This type of exposure requires a retelling of the traumatic experience and emotional engagement with those memories and feelings in order to get a genuine fear response. Efficient treatment only occurs if patients have the ability to access those memories and change their harmful responses. The problem is that symptoms of PTSD include avoidance of trauma reminders and disengagement with harmful emotions. Virtual reality treatment may be an alternative to CBT that still provides a high level of emotional engagement and a sensory-rich environment. The study was designed to include two groups, a VR treatment group and a waitlist control group. It was predicted that the VR treatment group would show a significant decrease in PTSD symptoms in comparison to the waitlist control group when assessed with both a post-treatment assessment and a 6-month follow-up. 10 participants ended up completing full treatment in VR, and 8 participants were placed in the control group. 9 of the participants had been treated for PTSD in the past with no rate of success. All participants across both groups were assessed using the clinician-administered PTSD scale, otherwise known as CAPS, severity scores, their World Trade Center exposure, and their socio-demographic characteristics. All participants in both groups were diagnosed with PTSD according to their CAPS score, with a mean of 69.31 for the VR treatment group and 71.75 for the control group. Both scores fell into the severe range and did not differ significantly from each other. The experiment began with an assessment by the researcher with the CAPS, the Trauma History Questionnaire, and the structured clinical interview from the DSM-IV, as well as various self-report questionnaires. VR participants would also provide self-reports before every treatment session. The VR environment was tailored to create a hierarchy of exposure to stimuli. Participants would gradually make their way through 11 sequences that increased in intensity and detail, beginning with a jet flying over the World Trade Center and not crashing, up until the intensity of the towers collapsing in a dust cloud. Treatment consisted of 14 75-minute sessions, 45 of which were used in VR. The pace of each patient's VR therapy was individualized to their specific fears and traumas. During the sessions, patients were asked to talk about their experience and give the therapist a self-reported subjective unit of distress scale, or SUDS rating, to rate their level of distress on a scale of 0 to 100 every 5 minutes. Each relevant experience in VR was repeated until the SUDS rating was decreased by 50% or more. The patient was therefore allowed to slowly get up to a more traumatic simulation. Results of this experiment showed that the VR group had a significant decrease in their CAPS severity score in comparison to the control group. Their CAPS score fell from an initial 62.5 to a score within the mild range of 39.9, while the control group remained the same. SUDS scores in the VR group started off at a mean of 46.35 during a simple and fairly non-intensive simulation, to the ending SUDS score of a mean of 25.57. During the 6-month follow-up, it was recorded that treatment was maintained. In conclusion, 9 out of the 10 participants in the VR group were shown to have improved condition over the control group despite previous treatment having little to no effect. A criticism to VR treatment is that each individual has a unique trauma, and a generalized simulation to that trauma would not have significant treatment results. The participants in this study all had varying degrees of exposure, and yet treatment was still successful. This shows that one VR simulation can have the sensory power to encompass various levels of a traumatic event and be an effective treatment tool for those who need it.